More and more people are in a hospital bed tonight. The state says the rates are rising.
Hospitals are running on fumes with new cases, overextended staff, and more holidays on the way. Healthcare professionals are getting ready for a rough winter. Kaitlin Knapp shows us what they're seeing as they look at the path forward.
Well, one issue is capacity. Not only do we have bigger hospitals with larger capacity like Sacred Heart, but we have the smaller ones too, like Samaritan Healthcare. They're getting hit hard. Take a look at this. This is the hospital ICU beds at Samaritan Healthcare. There are 12 ICU beds, and as of this afternoon, 8 of them are being used by COVID-19 patients. This can change quickly, but right now, this is one of the many hospitals in our region strained by the pandemic.
Alarming numbers from the state today. Nearly 12% of hospital beds have a person in them.
We're stretched now. If we continue to see increasing numbers, we don't have unlimited capacity. And as we get into another big holiday, that's where we're really concerned. We could reach a point where we're at the breaking point.
Though COVID-19 trends from the holiday aren't clear statewide, Dr. Dan Getz says Spokane County's feeling the effects.
If we continue to exceed what we saw the day before, and that's what's really concerning, I think this is absolutely a result of what we saw during Thanksgiving.
Here's what we're seeing at some Spokane hospitals. According to a national public radio study, Sacred Heart sees about 54 COVID patients a week, but only 13% of beds are being used by them. In Idaho, Kootenai County capacity levels are 15 to 20% higher than normal.
I think that's the concern right now. Although we have capacity, if we continue to see increasing rates throughout our community, it's going to be really challenging to continue to deliver care.
Staffing is another big concern, especially for smaller hospitals like Samaritan Healthcare in Moses Lake.
As we see a rise in the number of cases in our community, you naturally see a rise in the number of staff members that are positive, and that's our biggest concern.
The cold and flu season could soon be another problem on top of ICU beds available.
The big deal is we know we're going to have a higher than average census because of the time of the year, and we know there's more patients coming.
And healthcare workers are urging the community to help.
I think it's important to remember that the path forward, the path to decreasing the rate of infection is really to avoid those small gatherings, do all the right things that we do in the community, wearing masks, social distancing, frequent hand washing.
Now, to be clear, the number of people in a hospital can fluctuate hourly, so determining an exact number of capacity is hard. We know hospitals like Sacred Heart and Holy Family have the capacity right now, but again, it's still a concern. Aaron, Nia.